It's normal to feel self-conscious about dandruff, but those dry, white flakes on your skin are harmless and more common than you think. Actually, dandruff affects half of adults around the world. And it doesn't mean that you're dirty or unhygienic. It's a skin condition that's entirely treatable. On today's program, we'll talk about the causes of dandruff, common misconceptions about it, and how to effectively treat and prevent it. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines. Dandruff can often be a taboo topic, and consequently, many have tried to treat it on their own unsuccessfully. But contrary to popular belief, dandruff isn't about your hair or how often you wash it. It's a scalp condition that causes your skin to flake and itch. And giving your scalp the right TLC can easily relieve this condition. Our guests are here today to shed light on your scalp problems. With us is Dr. Mitch Carlos Tantiong. She's a dermatologist at the Makati Medical Center. And we also have Dr. Cheridin Oro Josef, a family and geriatric medicine specialist from the Marikina Doctors Hospital and Medical Center. Thank you both for joining us today. Now, in order to treat dandruff effectively, it's helpful to learn what's causing it. And there are many possible causes of dandruff, and a common one being seborrheic dermatitis. Dr. Mitch, can you tell us more about this?
Oh yeah, you're right. Seborrheic dermatitis is it's a pretty common but a chronic condition. No? It involves flaking of the hair. So you see white flakes, and then there's a background of redness or erythema or inflammation, and it can sometimes be topped with greasy-looking scales. And commonly, it's seen on the scalp, no, and we refer to that as dandruff or balakubak. But it can also be seen in other parts of the body as well.
Now, seborrheic dermatitis affects both men and women with mainly oily skin. And while it's most common in the scalp, like what Dr. Mitch said, it can affect other oily areas of the body as well. And there are some medical conditions that make adults more susceptible to seborrheic dermatitis. Dr. Cherry, could you share with our viewers what are some of these conditions?
Some of these conditions na maaring magiging mas pro ng isang patient magkaroon ng seborrheic dermatitis is number one, yung mga immunocompromised states na mga sakit, no? Like for example, diabetes or other chronic diseases, like for example, yung mga connective tissue diseases, etc.
Now, if you have any of these conditions and scalp problems simultaneously, please don't wait too long. Please consult your doctor. Now, aside from some of the common skin conditions like maybe psoriasis, there are other skin conditions that can cause flaking skin on the scalp. Dr. Mitch, could you also share with our viewers what are some of these skin conditions that can predispose people to this?
Yeah, of course. So aside from the dandruff, no, we can get scaly scalp if we have atopic dermatitis or what we loosely call as asthma of the skin. We can also have a flaky scalp if we have ringworm, no, which is or fungal infection of the scalp. And also, if we apply some products on our hair that cause a bit of an irritation, we can get contact dermatitis, which can produce flakes on the scalp and redness on the scalp as well.
Contact dermatitis is a common skin problem, occurring in around 15 to 20% of adults, but it's usually easily treatable. Dr. Cherry, let's remind our viewers what this is.
Contact dermatitis po, ito po yung nagkakaroon po tayo ng reaction towards something like a chemical, material that is having contact with our skin. So for example, minsan yung mga damit natin or even mga detergents that we use, no, to wash our clothes, our slippers, for example, rubber, all these chemicals can cause irritation sa ating mga skin.
Now, another cause of dandruff is yeast. Although this sounds daunting, malassezia is a yeast found in all scalp. It's part of the normal flora of the skin, with or without dandruff. But each scalp responds to this yeast differently, which is why some have dandruff and others don't. Dr. Mitch, can you explain this one further?
Sure. So seborrheic dermatitis occurs in areas of our body where we have a lot of oil glands. No, we call them like sebaceous glands. So these are our scalp, on our face by our eyebrows, the sides of the nose, around the ear. It can also occur in the chest, on the back, and on the folds of our body. No, and the yeast what you mentioned, the malassezia, it likes a lipid environment. It likes these oil glands. So the area where we develop seborrheic dermatitis is where the malassezia sort of feeds on. So these glands provide a good environment for the yeast to proliferate, thus leading to the skin conditions.
Ayan, at least malinaw na ngayon. Shampoo and skincare products can also irritate scalp and trigger dandruff. What should you do if a certain product is irritating your scalp?
Well, first of all, please stop using the product already. So that's the first thing you have to do if you find out that there's a product that's irritating your scalp. Second, we have to treat the scalp condition. So what does this involve? So first of all, it's good to consult your board-certified dermatologist to make sure that you're on the right track with treatment. Don't try to self-medicate. You might need to shift to a very mild shampoo, and you might possibly need some topical corticosteroids and some oral anti-itch medications to help relieve your condition.
There are risk factors naman that can make you more susceptible to dandruff. Dr. Cherry, what are some of these risk factors?
Yes, that's true. Kasi yung skin po nila medyo dry, no? Also, those who are very hypersensitive, no? Hypersensitive to a lot of things, even stress, no, can predispose one to a seborrheic dermatitis. No? So when you are immunocompromised and you are stressed and you have diabetes, you have all these diseases, it gives you high risk for developing seborrheic dermatitis.
That's right, and dandruff can occur actually all throughout life for some people. Dr. Mitch, at what age does dandruff usually occur?
So you might be surprised to find out that dandruff can actually occur among infants. So there's a first stage of dandruff, which happens usually before 3 months of life. But this infantile seborrheic dermatitis usually resolves on its own without treatment. Then again, when we become adolescents and later on in our adulthood, there's another increase in the rise of dandruff. So usually about 30s to 50-year-old persons.
Aside from age, sex is also one of the risk factors where dandruff is more common in males. Bakit kaya?
Okay, some males pa mas common ang dandruff. I think because they have more of oily skin, most of them, no? Because of the fatty depositions, etc. And because they also sweat a lot and they have this tendency to be more active. That is why it's more common among males also.
Fortunately, many dandruff cases will clear up soon after taking action. And we'll discuss the treatments available after a short break. We're your connection to healthcare. Stay with us on Med Talk Health Talk. For those of you who have dandruff or flaky skin on the scalp, we understand that it can be problematic. But treating it doesn't have to be. While there might not be a permanent fix, there are many convenient ways to find relief. I'm Dr. Freddy Gomez. Welcome back to Med Talk Health Talk, where your health comes first. Treating dandruff can sometimes be as easy as choosing the right shampoo. Now, anti-dandruff shampoo contains ingredients that aim to lessen the yeast in your scalp and keep your sweat glands from producing too much oil. Dr. Mitch, what are the ingredients you should look out for when buying anti-dandruff shampoo?
Yeah, so fortunately, a lot of mild cases of dandruff can be treated with just shampoo. And when you're looking to buy anti-dandruff shampoo, please look for the ingredients that read zinc pyrithione, ketoconazole, selenium sulfide, and if you have a lot of greasy scales, you might need a shampoo that contains either salicylic acid or tar, as these help declog the scales on the scalp. What's important is that the shampoo usually needs some hangout time on your scalp for the shampoo to work. No? So a lot of times we put the shampoo on, lather it, and then rinse it off right away. But for the shampoo to effectively reduce the yeast, it should be on the scalp for a few minutes. So I usually recommend that the shampoo stay on the scalp for about 5 minutes before rinsing it off to give it time to work.
Yeah, that's good to know. So at least 5 minutes for its effectivity to really get in there. Okay, now there are a lot of different anti-dandruff ingredients, and it's useful to know what the main ingredients do for you. What is the role of zinc pyrithione in fighting dandruff, Dr. Mitch?
So zinc pyrithione has some antifungal and bacterial properties. So this ingredient can help lessen the malassezia, the yeast that can lead to dandruff. And in that way, it helps lessen the flakes, the visible signs of the dandruff.
Does ketoconazole and selenium sulfide, which you mentioned also, is there anything else that our viewers need to know about these ingredients, Dr. Mitch?
Yeah, so both ketoconazole and selenium sulfide are antifungal, and ketoconazole is an azole, so it's a type of antifungal that actually also has anti-inflammatory properties, so it can help lessen both the flakiness and the redness, and that later on gives us problems with dandruff.
And getting the right fit of anti-dandruff shampoo may take trial and error. If you're not so sure which anti-dandruff shampoo to use, please ask your doctor for suggestions. Oftentimes, anti-dandruff shampoo is enough to keep it at bay. But if your scalp starts to feel itchy again, stress might be to blame in this situation. Dr. Cherry, how are stress and dandruff related?
Patients who are stressed may develop more seborrheic dermatitis, no? I think because it has a connection to their immune system.
Dr. Cherry, what should our viewers do kapag stress ang nag-aggravate sa kanilang mga dandruff?
Number one, we have to find out ano yung source of stress natin, no? We have to try our best to lessen the effect of stress in our body. So if you can practice mindfulness, meditations, or relaxation techniques, and try your best to focus on the moment, and then do not stress yourself with what will happen in the future, then it can help you lower down your stress factors. And remember, stress is the root cause of all inflammation, and inflammation is the root cause of all diseases.
If any of our viewers notice that you're having any scalp issues ngayon na pandemic, have a check with your doctor. Dr. Mitch, aside from anti-dandruff shampoos, what are other ways that our viewers can address their scalp condition?
So aside from the shampoos, we can also, depending on how severe the scalp is, we might suggest some steroid shampoos or topical steroid solutions if the scalp is very red. And actually really it's best to see your dermatologist, because if these modalities, the over-the-counter modalities, don't work, we may need to give oral medications like some oral antifungals and oral antibiotics to help address the condition.
Your dandruff can be more than just an itchy scalp, so it's best talaga na you consult your doctor if you can. Now, there are some surprising things about dandruff. We'll go through these after a short break. Keep it right here on CNN Philippines. Most people have experienced dandruff at some point in their lives, but not a lot know much about it. In fact, there are some very surprising stuff about dandruff. Our guests are here today to tell us more about this. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. Some say that washing your hair too often will strip away natural oils. Others say that not washing enough will cause dandruff. Dr. Mitch, is there a frequency in which you should wash your hair?
So like in everything in life, moderation is the key. Since we live in such a very hot environment, I usually recommend shampooing your hair once a day. So daily shampooing is important, I think, for both dandruff and just to keep our hair clean and free from the oil and the pollution.
Follow-up question, Dr. Mitch. Does this also go with those who brush their hair a lot? Is moderation still the key, or is brushing one's hair a lot, does that help with dandruff?
I think brushing your hair helps indirectly, because when you brush your hair, the oils of our scalp sort of, get redistributed. And of course, when you brush your hair, the dirt that gets to our hair goes to the brush, so it cleans out our hair, and that way it indirectly helps treat or control our dandruff. But please remember that dandruff is chronic, no? So it's a condition that waxes and wanes, so we can be treating our scalp for the rest of our lives. So aside from treating it when it's very inflamed and red and itchy, it's good to be sort of on a prophylaxis treatment. So sometimes I recommend that we use antifungal shampoos, the anti-dandruff shampoos, once a week, just to keep things at bay and to help prevent a relapse.
As a reminder, poor hygiene doesn't necessarily cause dandruff, but can make the flakes more visible. And washing your hairs once a day is always helpful. Now, ultimately, there are some that are just more prone to dandruff, but you can always take preemptive action, starting with your diet. Dr. Cherry, let's remind our viewers, what are foods to incorporate into your diet to combat dandruff and just be healthy overall?
We have to eat more vegetables and fruits to protect our skin because we need a lot of vitamin C and we also need a lot of zinc in our system. So we have to eat more fruits and vegetables, cut down on our fatty food and our salt intake. So basically, a healthy diet will also help our skin get better.
Now, while the right treatment will depend on the severity of your dandruff, natural remedies can protect your scalp on a daily basis. And these include oils, maybe aloe vera, apple cider vinegar, as well as aspirin. Dr. Mitch, how does tea tree oil and coconut oil help protect your scalp?
So these products are sort of adjuncts to treatment. They're usually not the mainstays of treatment. Tea tree oil, for example, can help lessen the scaliness that can worsen your dandruff. However, please be careful with tea tree oil as it can sometimes be an irritant causing contact dermatitis. But studies have shown that it has antimicrobial activity, so in that way it can indirectly help with treating dandruff. Actually, lately, coconut oil has become a bit of a superstar in terms of our skincare armamentarium. And I personally ask my patients with thick, greasy scales to apply coconut oil prior to shampoo, as this helps to sort of loosen up the scales, and it acts as a moisturizer or an emollient to naturally remove the flakes on the scalp. So it can help, but please still use your prescribed shampoos and medications.
That's right. Now, Dr. Mitch, if coconut oil is the new superstar, ang old school superstar is aloe vera. Does this help with dandruff?
I think aloe vera has a bit of moisturizing properties, so it can help soothe the inflammation that is associated with dandruff. Because you see, aside from the visible flakes that we have in dandruff, the itchiness and sometimes the burning sensation gives us more problems than what we can physically see. And aloe vera can help lessen the redness and the itchiness and the burning sensation of our scalp. But again, these are scientific basis for these remedies still have yet to be really supported. So it's best still to use your first-line therapies and these as adjunctive treatments.
That's right. And lastly, for Dr. Cherry, what does aspirin naman do to your scalp?
Aspirin, kasi I think it's because it's an anticoagulant and anti-inflammatory also. No? So it lessens the inflammation. That is why somehow, because of the decrease in inflammation, nakakatulong po na nababawasan yung reactions ng dermatitis.
Very good. Now, with these treatments and remedies that can help kill dandruff, all you need to do is find what works best for you. Thank you to our dermatologist, Dr. Mitch Tanchong, and family and geriatric medicine specialist, Dr. Cheridin Oro Josef, for joining us today. We appreciate your time very much. Now, our goal here on the program is to help you better understand the care you need and deserve. I'm Dr. Freddy Gomez. Join us again next time on Med Talk Health Talk. Stay safe, everyone. Thanks for watching CNN Philippines.